Hey guys, this is Landen for HSM 430. My group consists of myself, Madison Stump, Amy Semino, and Jack Shreve. Today's assignment is A3, which is going over ethical dilemmas in the medical setting. So, a brief introduction to describe my understanding and our group's understanding of what an ethical dilemma is. Dilemmas can come about when there is a hard decision to make for a patient or in any form of healthcare, when multiple views can clash, or something that may benefit a patient that could be seen as therapeutic by one person may not be morally sound, or it could be even illegal to the other person and they could report it, although it is benefiting the patient. Sometimes there is no clear cut right answer in these situations, but this is one of the largest challenges faced in the healthcare field, and there are methods to kind of work around it. So, to give you a brief summary of our case study that we have here, we are we're dealing with Jennifer Green, who is a 15-year-old that was recently diagnosed with leukemia. She's currently being treated with chemotherapy, and based on research, there's a good chance that leukemia can be cured, but she will have to go through a form of treatment for about 3 years with frequent monitoring in the form of blood tests and other procedures, which can cause a lot of anxiety, especially for a younger person. Mrs. Green, who is Jennifer's mother, inquired about possibly getting her a prescription for medical marijuana. She said since her last chemotherapy that her daughter Jennifer is still feeling sick from the medications and all that. Her aunt came over one time though and brought over brownies that contained marijuana in them. And they let their oncologist know because they wanted to be honest with them because that's what you have to do for that. And the oncologist explained that medical marijuana isn't legal in that state just yet, nor is recreational marijuana. So that's our first little ethical dilemma there. He cautioned against giving her any more marijuana, and he was going to consult the pharmacist to see what legal medications could be prescribed to help out with her nausea, appetite suppressant, and anxiety, which he found out later on that cannabis, a legal form of cannabis, can be prescribed. When talking, though, the team met up with Sarah White, who is Jennifer's social worker, and she becomes very upset at the fact that they gave Jennifer marijuana brownies because in the state it is illegal, and the way that Sarah sees it, that they need to report this to Child Protective Services due to this being child endangerment because marijuana is an illegal drug. The rest of the team, however, does disagree, noting that this is a one time occurrence and they're looking to find a legal method, which would be the cannabis, to help out with her, and that the Greens have been very responsible and caring, and that this is a terrible situation and this could be possibly made worse by reporting them to CPS, Child Protection Services. So when we look at our first subcompetency that we see, the first one that I notice is develop a trusting relationship with the patient's family and other team members. While it may be illegal in the state that Jennifer lives in for medical marijuana, the care team right off the bat does not judge her, and they let her know that, hey, this may be illegal. You don't want to try this out. However, we can look into legal methods, which the oncologist, got with the pharmacist about the cannabis. And, he kind of used the, hey, marijuana worked for them for this one time. We advised them not to do it. Maybe we can get them on cannabis because the results for this therapeutic treatment are very similar. So we look at our second subcompetency, manage the ethical dilemma specific to interprofessional patient population or patient and population centered care situations. This comes about when Sarah White, who is the social worker, threatens to report the family for giving drugs to a minor, especially in a state where marijuana is not medically prescribed nor recreational use is legal. And if the authorities were to get involved without the case manager or anybody reporting this, the whole care team could possibly face consequences by being guilty by association because they were let known by the family that their daughter did in fact take marijuana brownies. So now, the big thing is, what is the ethical dilemma that the team is facing? The ethical dilemma is that Jennifer's aunt, the one Alice, she brought over the brownies that contain marijuana in them to help Jennifer kind of get over her nausea and kind of help out with any anxiety because she knows that marijuana can tend to do that for people. Now, Jennifer's parents let her care team know, which the oncologist was just like, hey, I wouldn't do that again. I'm not going to report it, but let's see if we can find you an alternative going towards the pharmacist to kind of push towards cannabis. But Sarah White sees it from the legal aspect of things, and adults giving a 15-year-old an illegal medication that's not prescribed and it's not supposed to be recreational, it's very illegal. She thinks that this is totally wrong and that child protection services need to be involved because they're giving drugs to a minor. And this is where the team disagrees with the social worker because the parents actually do care for their daughter. They're just trying to see if a certain method would work, which we kind of found out it did. However, the legality of it is that marijuana is still technically illegal, although in some states it is legal and the therapeutic effects have been studied. So, moving on to our next one, what actions would serve the best interest for the patient, being Jennifer? So I think allowing Jennifer to explain to the social worker how it's helped her and made her feel better and that it was a one shot thing would be something good because they're not constantly giving it to her. They wanted to try something different because they've noticed that it has been taking a toll on Jennifer, especially in her weakened body state with leukemia. Now, allowing each team member to express their feelings to Sarah and make her understand how important this is to Jennifer, especially when she's talking about reporting her parents and possibly having Jennifer go into foster care. That could be very detrimental on her mental health, and she's already suffering from anxiety. So maybe not going that far, but kind of letting them know that you do not need to do this. This is a one time thing. We're not going to report it. Let's see if we can do something better. Um, and there are different routes you can take. The situation doesn't have to go to the extent of her reporting the parents. Jennifer and her parents are patient and wait for approval that she can't be in possession of medical marijuana or just be prescribed the cannabis, which would have the same therapeutic effect. On to the next one. How should the team respond to Sarah White's decision to report the Greens to the Child Protection Agency? The team should definitely stand with the Greens and fight for what they believe in. They should talk to her and explain that she may have gone too far with trying to get child protection agency right off the get go. Sarah does need to understand that without Jennifer's parents, she would not be as healthy as she can be, especially with the added stress of her possibly going into foster care. If Jennifer gets taken away from her parents, she may lose many things, and the care team that she's established with may be one of them because you never know. Um, and if Jennifer gets sorry, she would give up hope for trying to conquer leukemia because she has no more support team because her parents are now being taken away because Child Protection Agency. This would lead her to becoming more ill due to missing her doctor's appointments, treatments, and so much more. If Jennifer's parents were so cruel for allowing her to try marijuana, why would they even bother to bring her to her appointments? They want what's best for Jennifer. I feel as if Sarah is not seeing the whole picture. She's more seeing the legal aspect, rather seeing what it's actually doing for Jennifer and knowing that it is just a one time thing that happened. It's not chronic, and they are working with the care team, taking the oncologist's advice and going to talk to the pharmacist to see if there is an alternative. And then now we're looking at what evidence is there that the Greens have a trusting relationship with the members of the care team, and how would reporting them affect this relationship? The team knows how deeply they care for Jennifer and her well-being. They would not be they would have not stood up to Sarah if they did not trust the parents' right decision in allowing her to try the marijuana brownie. They knew if she didn't try it, it wouldn't They knew if she didn't try it, they wouldn't know how else to help Jennifer feel better. Jennifer's family would be mad and upset with the social worker who reported them, and then Jennifer's family will still believe and trust the team that stood up for Jennifer and fight alongside them to bring Jennifer back to her family and not have this reported. I do think, too, that the team could possibly work with Sarah as well to kind of let her know that she may be overreacting at this point. And then the last question I see is what evidence is there that the team members have a trusting relationship with each other? We see this with the theme, with the exception of Sarah White. Um, we see the whole care team, the oncologists, nurses, and the family are all on the same page. However, they are working with Sarah to kind of let her know that, hey, maybe this isn't the best idea. You shouldn't report them. And plus, we see the better relationship between the oncologist and pharmacist because the oncologist goes to the pharmacist, lets them know what's going on, and the oncologist lets them know that cannabis is a legal cannabis that can be prescribed, and this could possibly help. So, in conclusion, I do think while this is a major ethical dilemma, I think there are ways to work around it, especially talking about the two subcompetencies that we see with developing that trusting relationship with the patient's family and other team members, seeing that, the team has that connection with the family and they want to make sure what's best for Sarah, and whether that be getting her to take the cannabis and not using medical marijuana or just letting it go under the radar and not saying anything about it. And then our another one is managing the ethical dilemma specific to interprofessional patient population centered care with Sarah possibly threatening, to take Jennifer away from her family. The care team comes and tries to manage it and kind of work out an impetus so that way they let her know that, hey, it was a one time thing. We're working on getting her a legal method that does the same exact thing. Um, I do stand with the care team's decision to try to find an alternative rather than um, report Jennifer's family because that can cause another issue. And then she's already dealing with anxiety due to the treatment and everything. This could lead to way worse. Um, and and that while ethical dilemmas may arise, there are ways to work around this with communicating with the team and communicating with the family being a very important aspect. That's all I have for this. Thank you. Have a great day.